Bismillahirrahmanirrahim. This is the screencast for the lecture number 20. This lecture we are going to discuss about pathology of vascular diseases affecting the lung. So after this lecture, the students will be able to list the causes of pulmonary hypertension and explain the pathogenesis related to the pulmonary hypertension and mechanisms related to the pulmonary embolism. So, embolism means any substance, whether it is a liquid, gas or solid substance, which detach from the primary area and traveling in the blood and affecting the other organ, that is called embolism. In the lung, the most commonest embolism comes from the thrombi, so it is called thromboembolism. This thrombi comes from the deep veins of the leg in 95% of the cases. The thrombi which is getting formed in the pulmonary artery, that is called large vessel in situ thrombosis, are very rare. Okay, they develop, that is the pulmonary artery developing the thrombus is seen only in few conditions such as pulmonary hypertension, pulmonary atherosclerosis or in heart failure. So most of the emboli which comes from the deep veins of the leg, so this is called deep vein thrombosis, and this is the disease which comes affecting the vessels in the leg. And from deep vein thrombosis, the thrombi gets break and it travels in the venous system and it enters the right side of the heart and it goes to the pulmonary artery and it affects the lung. So let me explain in detail. So consider this is the veins in the leg, deeper veins in the leg, and there is a thrombi formation. Okay. So this thrombi gets formed due to some problem in the veins wall, venular valve insufficiency, or due to bed rest. Okay, so the any varicose vein. Okay. So any reason which makes the blood to stay more in the deep veins of the leg, it is a deep veins in the leg compartment. So what happens is the thrombi is formed. If the thrombi gets break, it travels in the venous side of the systemic circulation and all the venous side enters the right side of the heart. They enter the right side of the heart. Okay, they enter the, now the thrombi enters the right atrium. From the right atrium it goes to the right ventricle. So now the thrombi enters the right atrium, enters the right ventricle. From the right ventricle we have pulmonary artery, which is called pulmonary aorta, and it gives two major branches for the right and left side of the lung. Okay, if the thrombi is getting big and if it affects the pulmonary artery at the level of bifurcation, it affects the major part of the lung that causes severe pulmonary infarction. Okay, if the thrombi in another case, I am drawing in blue color. If the thrombi is small, it is traveling in the pulmonary artery and it is entering the lung. Okay, and in the lung, the pulmonary artery becomes pulmonary capillaries. Okay, they become pulmonary capillaries. The arteries give branches and they become pulmonary capillaries. And we have alveoli. We have alveoli, right? So that is the area of gas exchange, alveolar membrane and the capillary membrane. Now we have a emboli which is traveling in the pulmonary artery and going to the pulmonary capillary, and it is blocking the pulmonary capillary. So when they block the pulmonary capillary, the blood coming out of the block is not possible. So the blood coming out of the block is obstructed. So automatically this will lead to non-perfusion of that area. Then gas exchange cannot happen. That causes respiratory compromise. Respiratory compromise. Because of that, the resistance of the blood vessel is affected. That alters the hemodynamic mechanism and that causes hemodynamic compromise. So if it is a emboli is small, it causes respiratory compromise and hemodynamic compromise, but infarction is very small, but it will not happen easily because lung has dual blood supply. They have blood supply from the bronchial artery which comes from the thoracic aorta, which comes from the systemic circulation. So that's why the lung has dual blood supply. So even if the large emboli which affecting the lung, when the infarction happens, it is of red infarction. If it is of red infarction, understand? So this is about the mechanism of pulmonary embolism. Okay, so there are two main consequences happens in pulmonary embolism. What happens is there is non-perfusion, because if it affects the emboli blocks the pulmonary capillary, so that will leads to respiratory compromise. Or this emboli block will alter the pulmonary blood flow and leads to increased resistance. Again, that will alter the pulmonary blood flow, which is caused by this embolic obstruction. So when there is emboli, that will lead to the increased resistance that will alter the pulmonary blood flow, that is called hemodynamic compromise. Okay, now I discussed about two types of emboli. One is large emboli, which can affect the main pulmonary artery or its branches or at the bifurcation. So it forms a saddle shaped emboli, so we call it as a saddle embolus, which results in sudden death. Let me explain why. So for example, now the person is having a deep vein thrombosis, and this all venous drainage goes to the right side of the heart, and we have the right side of the heart, and this is right atrium, this is right ventricle, and this is left atrium, this is left ventricle. From here the pulmonary aorta comes, they give branches and pulmonary artery is formed, they go to the lung. When they go to the lung, okay, so then they form the capillaries, and the capillary surrounds the alveoli. The capillary, so they form the capillary, and the capillary surrounds the alveoli. Okay, this is the pulmonary capillaries. If there is large emboli that is coming from the deep vein and it is traveling, and it is coming to the right atrium, coming to the right ventricle. It is blocking the pulmonary artery at the bifurcation. What happens is immediately the blood flow from the right ventricle is literally blocked. What happens? The pressure is increased. Then the pressure in the right ventricle is increased. This happens in an acute stage. Then the right ventricle fails. Right ventricle fail. So that is called lung disease, that is pulmonary embolism, which affects the heart. So that is called cor pulmonale, and it is acute, so it is called acute cor pulmonale. So the acute pulmonary embolism, the large embolism which affects the right ventricle, end up in the failure of the right ventricle. So that is called acute cor pulmonale. So that's what they end up in a sudden death due to acute failure of the right side of the heart. That is called acute cor pulmonale. Whereas in the smaller emboli, that travel into the more peripheral vessel, that is capillaries, and they cause hemorrhage or infarction. In patient with adequate cardiovascular function, okay, the cardiovascular function is normal, aorta gets good blood, so the systemic circulation gets good blood, so bronchial artery supply will be good, that will sustain the infarction. There will not be infarction. Okay, hemorrhages may occur. So that's why it is very important to know what type of emboli, whether the large emboli or smaller emboli. Large emboli produce sudden cardiac failure, that is called acute cor pulmonale. The small emboli manage the blood supply because of the dual blood supply, bronchial arterial supply. So pulmonary infarction is usually hemorrhagic because of dual blood supply, which means the infarct area will become red to blue in appearance. Now coming to the pulmonary hypertension. Okay, so before going to that, let me describe what is blood pressure in a simple way. And you all know we have right atrium, right ventricle, left atrium, left ventricle. When the left ventricle is contracting, that is systole, the blood comes out of the left ventricle with a pressure that is called systemic blood pressure 120 mm of mercury. When the left ventricle is dilating, then the pressure falls, that is diastolic systemic blood pressure to 80 mm of mercury. Okay, now right ventricle. When the right ventricle is contracting, the blood goes to the pulmonary artery with a pressure of, that is systolic pulmonary blood pressure is around 30 mm of mercury. And if the right ventricle is dilating, they dilate, the pressure falls, that is diastolic pulmonary blood pressure will be of 15 mm of mercury. Okay, I will draw it in a screen. It's very important to understand this concept. Now we have right atrium, right ventricle, left atrium, left ventricle. The blood comes from the venous side to the right atrium, then it goes to the right ventricle, then it goes to the pulmonary artery, then it goes to the pulmonary capillaries, and it comes to the left atrium from the pulmonary vein, and it goes to the left ventricle, then it goes to the aorta. When it reaches the aorta, it goes to the systemic circulation. Okay, so this is systemic circulation. This is the venous side. Okay, now when the left ventricle is contracting, the blood goes out to the systemic circulation with the pressure of, with the blood pressure of, that is systolic blood pressure, that is 120 mm of mercury. And then the ventricle dilates, then the systemic diastolic blood pressure will become 80 mm of mercury. So this is happening in the systemic circulation. Likewise, when the right ventricle is contracting, that is pulmonary systolic blood pressure is 30 mm of mercury. When the right ventricle so when the right ventricle is dilating, see, let's concentrate on the right ventricle, the picture gone. When the right ventricle is dilating, the blood goes down with the pressure of, that is pulmonary diastolic blood pressure will be reduced to 15 mm of mercury, whereas pulmonary systolic blood pressure is 30 mm of mercury. Okay, whereas now you know about systemic blood pressure. Okay, systemic circulation systolic blood pressure is 120 mm of mercury, and systemic diastolic blood pressure is 80 mm of mercury. So this happens due to left ventricular contraction, and this happens due to left ventricular dilation. Okay, so if you see carefully, the pulmonary blood pressure is, for systemic blood pressure is 120, and the pulmonary blood pressure is the pulmonary blood pressure is 30. So this is pulmonary, this is systolic. Okay, so what we are saying is the pulmonary blood pressure is 1/4 of systolic blood pressure, 1/4 of systolic blood pressure. Okay, so approximately it is 1/4 of systolic blood pressure. So when the person should maintain the pulmonary blood pressure as 1/4 of his systolic blood pressure. Okay, keep that in your mind. So if the person's systemic blood pressure, approximately systemic blood pressure is 120, his pulmonary blood pressure is 30, it is normal. If the systolic blood pressure is 160, then the person's pulmonary blood pressure is, for example, 40, then again it is normal because it is maintaining 1/4. But the person is having systemic hypertension, that is agreeable. So this person is having systemic hypertension, but he is maintaining the normal pulmonary blood pressure because it is only 1/4. If it is increased to 50, then the person is having pulmonary hypertension. Okay, so this is the criteria which I want you people to understand. Okay, so keep that in your mind. So the pulmonary hypertension means averagely pulmonary pressure reaches 1/4 of the systemic level. Okay, so near it reaches 1/4 or more, it is called pulmonary hypertension. So the normally we say it is 15 to 30 mm of mercury in systole and 8 to 15 mm of mercury in diastole. So there are certain conditions which causes pulmonary hypertension. The most commonest one you should remember, these are the conditions: any left heart disease or lung diseases, or if there is thromboembolic event. These are the three most commonest one causes pulmonary hypertension. And remember, this pulmonary hypertension leads to right ventricular hypertrophy. Systemic hypertension leads to left ventricular hypertrophy. Pulmonary hypertension leads to right ventricular hypertrophy, and this end up with cor pulmonale, but it is chronic cor pulmonale. It is not acute cor pulmonale like we saw in the large embolism. Okay, so some people, they have idiopathic pulmonary hypertension, which is most common. We don't know the cause of it, which is most commonly seen in women of 20 to 40 years of age, and so this is called idiopathic pulmonary hypertension. They have difficulty in breathing and fatigue, and they have chest pain of anginal type. Okay, so this is about pulmonary hypertension. This ends the vascular diseases. Dr. Sylvester in the lab, he will discuss about chronic venous congestion of the liver.